Hey everybody, it's John here. So I wanted to do a follow-up video about my operation. I've had my PCNL, it's going on about 3 weeks now, maybe 4 weeks. Needless to say, I feel great. So here's what your takeaway should be. First, you want to eat a full, real meal before your surgery. Second, you want to make sure you get a firm understanding from your insurance company and from the hospital if once you pay your deductible, will there be any subsequent charges that you're not aware of? And by that I mean if you got to stay a week in the hospital or if you got to stay just one night in the hospital, you want to make sure you know what's involved and what you're going to have to pay for in addition to your deductible later. Here's why. Okay, so Wednesday I ate a meal, and we ate at McDonald's, and I had a hamburger and fries, and at that moment, that was enough. The next day, at about 5 a.m., we wake up, we travel over to the hospital to report in at 6 a.m. At about 7 a.m., I met with the doctor. Now, the doctor says, we got a fork in the road here, and you need to decide what you want to do. If we leave a tube from the kidney through the back, that's 2 nights in the hospital. But when you leave here, you're done. You don't have to do anything else. Or we can put a stent in from the kidney to the bladder, and you only have to stay in the hospital 1 night. So that's when I'm laying there thinking, 1 night in the hospital versus 2 nights in the hospital. What's that going to cost? What's the difference in price there? So I opted for the stent and 1 night in the hospital. Now, don't get me wrong. We're staying here in the RV. We weren't running off anywhere. I didn't have a job to go off to. So, the extra night in the hospital didn't mean anything to me time-wise. But I was worried about the cost of it. That's why I said, really discuss this with your insurance company and with the billing department at the hospital. Because, in all honesty, I would have rather stayed an extra night. So the surgery went off really well, although my kidney stone wound up being 43 millimeters in size. Just so you got a feel for what that means, a golf ball is 43.5 millimeters in size. So my kidney stone was huge. I woke up, I felt a lot better as far as the kidney stone goes, although I had a catheter in, and that was a really uncomfortable experience. If you focus on the pain and the discomfort, that's going to be a real thorn in your side. So try to, distractions, what have you, to get your mind off of that. So that's Thursday. Thursday afternoon, going into Thursday evening, I was ready for a full 5-course meal. And I was hungrier than anything. The problem is they wouldn't feed me anything. They fed me Jell-O and gave me clear fluids to drink. They gave me some broth. But I was ravenous. Needless to say, by the time Friday came along, I was starting to feel hungry and weak. I was starting to feel weak because I hadn't eaten anything. So when they say, how do you feel? I wanted to get the hell out of there, but I was feeling weak. Now, the other thing about asking your insurance company in the hospital about is my deductible cover everything is because the pain was such that every 4 hours I was eligible for a shot of morphine and a Oxycontin pill, and I took them up on that. Don't get me wrong. I wanted to alleviate the pain, but eventually the question in my mind went back to the cost. We've all heard the horror stories of how an aspirin costs $25 when you're stuck in the hospital. So I'm laying there in pain, and I'm starting to worry that if I ask for the morphine shot, is that an extra $500 I wasn't counting on? I don't know. I didn't know. I should have known. I would have taken more pain medication while in the hospital, but I missed out on that. They pulled the catheter out the day I left. That was pretty uneventful, pretty quick. I went home. Recovery was almost instantaneous. I was ready to do stuff the next day. I felt fine. The weird thing, though, is the peeing. The first day or two, you are peeing what looks like tomato soup, basically. I mean, it's that red, and it was thick, and had some clots in it and stuff, and I was a little worried about that. The day after that, it lightened up, and it wasn't as thick, and was more like cranberry juice. But still, it was red and had blood in it. After a couple of days, that all went away, and I was left with the stent in from the kidney to the bladder, as I said. Now, a week after the surgery, that stent may be moved around, and it may have been because I was the way I was sitting or what have you, but I felt some pain in my in that area from the stent, and I was worried that the stent was going to go like poking through the wall of my kidney or something. So I really took it easy. In hindsight, I shouldn't have been worried because the stent is actually, it's about a foot long and about the diameter of a piece of spaghetti, but at either end of the stent are like pigtails, so it's sort of locked in place once they put that in there. So let's fast forward now to 2 weeks after the operation when they want to remove the stent. We go back for our follow-up visit, and they're going to remove the stent. And this is where it really sort of sucked, because what they do is they take a big syringe full of lidocaine and they inject that up there. So that I wasn't into that. That sucked. And then they take the camera, which is about 2 feet long and about the diameter of the maybe a straw, and they stuck that up there, and that was not enjoyable. And then they grab the stent and pull it out. The whole process of going up there with the camera, grabbing the stent and pulling it out, maybe 15 seconds. So, I mean, as much as it sucked, it wasn't completely miserable. The thing that was miserable, though, was urinating after the stent was removed. You've heard the expression, pissing razors? I now know where that comes from. Because with that stent out, I don't know what it was doing, but with that stent out, for like the next 3 days, it was horrible peeing. It was just, I did not look forward to that experience at all. But then after 3 days, it went away, and life got better. Now, I would normally say that's the end of my video, and I appreciate you watching and all that. Please subscribe, what have you. But they discovered kidney stones in the other kidney. So the plan there is that they don't have to go in through the back for those. They're going to go up and use the little nippers and the camera and all that. So we've got that surgery coming up in 2 weeks. Needless to say, I'll do a follow-up and lay out what my experience is like with that procedure. So you haven't seen the last of me. If you have any questions, leave them in the comments. Otherwise, I appreciate your looking, and please subscribe. Thanks. John out.